Okay, everyone, we're going to go ahead and get started. Good morning to everyone out there. My name is Micah Matthews. I'm one of the marketing directors here at Messer Financial Group. Hope everyone's off having a great AEP so far and is ready to go or getting ready to go for the OEP. A lot of opportunities this year. That's kind of the theme for all the webinars and trainings that we've done, is just to go over all the different opportunities, new opportunities, carrier expansions, and just a real rejuvenation in some of these local markets for ACA. I know a lot of people kind of got out of the ACA business just because of the fact that there wasn't many opportunities. Well, that, my friends, has completely changed. So I would like to thank everyone for taking time out of their busy schedules to join us. We are going to be graced with the presence of Molina. We have Tina Martinez and Dennis Pujols, who are both with Molina, to go over the South Carolina and Mississippi markets. That's their expansion areas. Huge opportunity, very competitive, and I'm going to let them talk about everything as to why choose Molina. But before I turn it over to them, I would like to go over just a few things that will apply to you and I think are something that you should absolutely take full advantage of. Number one is every year we do a top producer summit where we fly people from all around the country, our top producers, to Concord, North Carolina. We put them in a nice hotel. It's fully covered. We give nice food. We have events. We do, there's golf, there's speedway, there's botanical gardens, all kinds of fun activities. We have all the carriers there. But I'll tell you what makes it priceless is the interaction that you have with other top producers. To be in a place where you can be around all the best in the business and interact and join ideas and combine ideas like they do is pretty priceless. And really, they're willing to give you their advice because they're not really competitors because they're in other markets. So again, it is a great time, and all you have to do to qualify for this is to have 200 members on the books. Now, with carriers, carriers have incentive trips on where they take people, and those are great, but that's based off of the previous year's production requirements. With Messer Financial, once you hit that 200 members on the books, whether you sell anything the following year or not, as long as you still have 200 members, you continue to qualify. So our trips are top notch. We have award ceremonies. We give out what we call our Crystal Eagles, which all of our top producers will receive one of those. So it's a great time, a lot of great information, and I would love to see everyone there. And the ACA is a great way to add, if you're working MA, to add additional business to you to get to those numbers. Also, another thing, one thing that we are offering that nobody else is offering out there, and I want everybody to pay close attention to this, is the opportunity for advances, okay? So if you're wanting some extra money before Christmas, we're able to do that for you. So if you partner with us with Molina in South Carolina or Mississippi, we will give you a 3-month advance prior to Christmas based off of your current book of business at that time. There will be an additional 3-month advance in April after the OEP is over. So you have 2 chances for advances, a 3-month advance before Christmas and also another 3-month advance after OEP when all the business and disenrollment is over. So again, that's a huge benefit. Plus, we do have vouchers to take care of any cost of getting appointed with Molina as well. So there's no cost, no production requirements, and there's also chances for advances. So huge opportunities with Molina. We want to take full advantage. Plus, we do have our own enrollment platform. For those of you that are new to Messer Financial, we have an ACA and Medicare Advantage enrollment tool built into one. So now you can do telephonic sales for MA and ACA. It's an enrollment system that you can do the entire enrollment for the client. We have webinars. If you look, this is our webpage, what you're seeing on our screen. This is messerfinancial.com. Under Agent Resources, you can go down to Messer Learning Center where we have all of our webinars that we've done in the past too. So you're more than welcome to come back on there and look at those. So like I said, we have webinars on our platform. We have webinars on other carriers, different products, etc. So we always try to give you guys the most up-to-date information with the biggest opportunities because we do not want to miss out on these. So that's pretty much all I have. We are going to have everybody in listen-only mode. There is a place on your screen where you should see where you can, if you have any questions, you type it in, and then at the very end, we'll go over all the questions and make sure that you guys have everything that you need. So again, I want to thank everyone for joining us, And with that, I'm going to turn it over to Tina and Dennis and let them go over what they need to. So Bobby, if you could switch the screens, that'd be great. Thanks, guys. Take it over.
Good morning, everyone. This is Tina Martinez. Thank you for joining us this morning. Dennis Pujals, as you all know, is also on the line. He is the broker channel manager for North Florida and Mississippi. I am the broker channel manager for South Florida and South Carolina. This is the 2020 Marketplace Update. The Molina story started with an emergency room physician by the name of Dr. David Molina. He saw that the healthcare system that cared for people on a budget needed a change. So Dr. Molina believed that every patient should be cared for like a family member. In 1980, he opened a community clinic in California where caring for people was much more important than their actual ability to pay. Today, his legacy lives on through the Molina Healthcare system, serving with people through Medicare, Medicaid, and Marketplace. Molina remains true to his convictions, treating each and every member like a member of our family. Molina Healthcare's mission is to provide quality healthcare services to financially vulnerable families and individuals covered by government programs. We are a Fortune 500 company and we rank 168th on the list. We are publicly traded as well on the New York Stock Exchange. Our estimated revenue for 2019 is $16.4 billion, servicing over 3.4 million members as of the first quarter of 2019 across 15 different markets. Who is our target customer? For Marketplace, our target customer is the uninsured, Medicaid transitioners, the parents of CHIP members, heavy subsidized, low income, and members that are used to getting care from safety net providers. That market segment consists of the 100 to the 250 federal poverty level, the FPL. Their annual approximate incomes for those individuals are $12,490 to $30,150. As you all know, open enrollment is just a few days away, starting November 1st, closing December 15th, with effective dates of 1/1/2020. If you do write in the state of California, they've already started as of October 1st for active renewals and passive renewals October 15th. Where is Molina right now? Right now, Molina is across 122 counties in 9 different states, servicing over 310,000 Marketplace members. Those states are Florida, Ohio, Michigan, Wisconsin, Texas, New Mexico, Utah, California, and the state of Washington. Where is Molina going? Molina is going, we're expanding. We're expanding quite a bit. So we're going into South Carolina and Mississippi, as you all know. We're growing our footprint over 60%. So by growing our footprint 60%, there are 74.5 million Marketplace eligible members. So as I stated earlier, 122 counties, we're expanding into 78 more for a total of 200. So that's a lot of opportunity to write business with Molina.
So Mississippi, one of the states we're going to be entering is Mississippi. We're going into 19 different counties in the state, starting, let's go through the counties. So DeSoto, Forest, Hinds, Hancock, Harrison, Jackson, Jones, Lafayette, Lamar, Lee, Madison, Marshall, Pomola, Pearl River, Pontotoc, Rankin, Tate, which is Union also, and Warren. So you basically along the Gulf Coast, we do have right along Jackson, Mississippi, which is to the central western part of the state across the Mississippi River, and the northern part of the state just south of Memphis, Tennessee, that area also. So going on. So we're going into 19 states. It's going to be a brand new state for us there. Latina, you want South Carolina? So in South Carolina, we're going to be going into 20 additional counties. Aiken, Allendale, Bamberg, Barnwell, Charleston, Calhoun, Clarendon, Colleton, Dillon, Edgefield, Fairfield, Kershaw, Lee, Lexington, Marlboro, Marion, McCormick, Orangeburg, Saluda, and Williamsburg. So all eligible service areas on the marketplace side.
Our Molina Healthcare product update. So this year, Molina is rebranding our product names. We used to have, generic names such as bronze, silver, and gold. This year, we're changing our names to Core Care Bronze, Constant Care Silver, and Confident Care Gold. So we're moving away from generic product descriptors. We're increasing our visibility on healthcare.gov. So we're going from 3 to 5 metal plans in certain counties and areas to over 17 plans. So that gives us the flexibility for separation of pricing and services. This is a brief overview of what our marketplace plans will look like this year. We will have a high option and low option bronze. We will have a high option and low option silver, and we will have a gold plan. On the high option plans, the bronze, the silver, and the gold, we will have the ability to provide adult vision services this year. That's one difference between the high option and the low option. The other differences are on our copays. Our urgent care for the high option bronze and our primary care will be a flat $35 copay. Specialty care will be $85 after the deductible on the high option bronze. And as you can see on the high option silver and low option silver and the gold, there are flat dollar copays for urgent care, primary care, and specialty care visits. Other differences are on our prescription drugs. High option bronze has a flat $32 copay for tier 1, and tier 2 through 4 are percentage after deductibles. On the high option silvers and low option silvers, we have tier 1 and tier 2 have a flat dollar copay for those tiers, and gold as well. So those are a few differences. The other things I do want to point out, wellness visits are no charge. We want to make sure that members understand what the difference between a wellness visit is and a regular PCP visit. If a wellness visit constitutes the member going into the doctor's office and, checking their blood once a year, checking their blood pressure, that's a wellness visit. It's not a visit for the member to say, hey, my shoulder hurts, my knee hurts, my elbow hurts. Then that doesn't constitute a wellness visit any longer. Then they would be charged the copay. So you need to educate your members the differences of a wellness visit and a regular doctor's visit. Preventative drugs, of course, are no charge as well. This year we have a new added capability. It's called telehealth via Teledoc. It's a virtual care system. All Molina Marketplace members are eligible to receive this service. They are subject to a PCP copay. So for example, if they are in a high option bronze, their copay for this service would be $35. Once they make that copay, they will receive a phone call from a board certified internal medicine or family practice doctor within 45 seconds. Extremely quick. So it's very convenient. They can have access to it 24 hours a day, 7 days a week, 365 days a year. It's done a few different ways. This service already went live in Texas and in California. We've gotten an excellent response from the members. They're extremely happy with the new service. The service will go live in Mississippi and South Carolina for the 1/1 effective date. How can they access the benefit? A few different ways. They can go onto the molinahealthcare.com website, click on the members tab, then scroll down to where it says virtual care and click on that logo that says Teledoc. It'll ask them for some credentials as far as logging in, making their payment, and then they'll receive the phone call within 45 seconds. They can also go onto their mymolina.com account, log in, make their payment, receive the phone call. And we do have an app for the members to download that is available on the Android and iOS systems. The app is called Molina Health in Hand. They can download the app, log in with their credentials from MyMolina, and access the service that way. Our added capability of adult vision benefits is through VSP. So there are no co-pays for exams and frames. The plan frequency is a 12-12-12, so one exam, one lens, and one frame every 12 months. Frame and elective contact lens allowance is $150. Something to note, adult vision services are not an essential health benefit. So plans that include adult vision services have an additional premium cost. The plan cost is not eligible for premium subsidies under the APTC. So if you do have a member that does not want to make a payment on a monthly basis, please make sure that you do not select a plan that has adult vision services. The members who do select a plan that does have adult vision services will receive an invoice disclaimer. The invoice disclaimer will state your plan includes adult vision services for which premium subsidies may not be used. So they would be responsible for that premium. A new CMS rule requirement. This is a change from CMS. This is not a Molina change. This is actually directly from CMS. Just please make note when you're enrolling your members. For plans that include both brand prescription drugs and its generic equivalent, the brand drug is not considered an essential health benefit if the generic is available. So if you have a member that has a thyroid problem and is on a medication by the name brand drug of Synthroid, and we have our generic available, they will not cover the brand name drug any longer. It's not considered an essential health benefit. So if they would like to appeal that, they can do so if it's medically appropriate for them. The Molina Healthcare website has redesigned our plan page. So the plan page was very cumbersome, difficult to navigate in, so we've made it a little bit more streamlined. You can actually filter plans if you want to do just silver, gold, or bronze. You can do so. You can actually have a little summary of the plan, do the SBC or the EOC. There's plan brochures as well, drug lookups, and our drug formulary is available on our new plan page as well. The Molina Network operations.
So in Mississippi, what we usually do, we entered Mississippi in 2018 on the Medicaid side. So what we usually do when we're entering on the ACA side is we follow the footprint of our Medicaid or our Medicare that has already been established. So on the Medicaid side, we already do have 137 hospitals, 1,717 primary care providers, 5,000 plus specialty care providers, and another 833 ancillary providers. They are throughout all the states. On the Medicaid side, we're in every county. Now, on the ACA side, we're not in every county. We're going into 19 different counties. But in those counties, we do have we will follow our footprint. So just a quick glimpse, and just to name a few of our highlights in Mississippi. Part of our hospital network is Baptist Memorial Healthcare Corporation. They include 16 hospitals and 400 providers throughout the Jackson and North Mississippi. North Mississippi Health Services. They have 7 hospitals, including the largest North Mississippi hospital in the area. Merit Health, which is Community Health Systems. They also have 9 hospitals in the area and 25 clinics. Forest General Health, they provide 5 hospitals in the Forest, Lamar, and Toll River area. Hattiesburg Clinic, they're also in the Forest, Lamar, and Jones area, multi-service, they're multi-specialty group with over 350 providers in their service area. Singing River Health System, which is a premier PHO, it's in the Jackson and Harrison area, and Memorial at Gulfport, which is in the Harrison, Hancock, and Jackson area. The system includes a flagship hospital on the Gold Coast with 95 clinics and 375 different providers. So in South Carolina, we do have just
South Carolina.
Go ahead.
Sorry. For our providers in South Carolina, the hospitals include Aiken, MUSC, AU Medical Center. Yes, AU Medical Center is located in Augusta, Georgia. So members can cross state lines to receive care at Augusta Medical Center. That's pretty much for the members that are in the Aiken area, the western part of the state. We have McLeod Hospital, and yes, we do have Lexington Medical. When I was in South Carolina, that was quite the most popular question that I received. We will have Lexington Medical Center in Lexington County, and McCaw Hospital. In addition to those hospitals, we do have the groups that correspond with those hospitals. So MUSC Physicians, McLeod Physicians, AU Medical Associates, and United Physicians, Unify. This is just a highlight. This is not a complete list. We will have our provider directory for our expansion areas up and running November 1st on our molinahealthcare.com website. So how can you find a provider on our website? Go to molinahealthcare.com, click on Find a Doctor or Pharmacy. Then it'll give you a provider search screen. The provider search screen, I highly recommend for members and you as an agent to search by zip code. It'll give you a much more approximate result to the member's location. Once you enter that zip code, scroll down to where it says select coverage and provider type. Make sure that you select Marketplace. We do have Medicare and Medicaid in the state of South Carolina and Mississippi, so please make sure that you select Marketplace. Provider type, make sure you select whatever provider it is that you're looking for, a PCP or a specialist. If you want to do a more advanced search, you can click on the specialty section and click on whatever specialist that you're looking for, cardiologist, pulmonologist, etc., and hit that search button. Our pharmacies and prescriptions. Molina contracts our pharmacies through CVS Caremark. You can locate their locations by going onto the caremark.com website and onto our website, molinahealthcare.com. Same concept as our website. Enter in the zip code and hit that search button, and it'll give you the results. The Molina member communications. This is our invoicing and payment options. So binder invoices are mailed upon receipt of enrollment files from the exchange and monthly thereafter. Unfortunately, we don't have a paperless option at this time. Hopefully in the near future we will. Binder due dates are due the first of the coverage effective month. So for the month of January, binder payments are due January 1st. Premium for that are the 25th of the month prior to the effective month. So for example, January, they make their January 1st payment, and then January 25th, their payment will be due for the month of February. We do have autopay. Autopay withdrawals on the 23rd of the next business day if it does land on a holiday or weekend. How can members make payments? Several different ways. As I stated earlier, we do have the autopay feature. Members can enroll by going onto their My Molina account, by going to their mymolina.com and logging in. They can make a payment online off of a mobile device or a desktop computer by going to molinapayment.com. They can do IVR by savings, checking, Visa, MasterCard, or Discover card. So that's an interactive voice response system, IVR. By mail, good old-fashioned United States postal mail. Please make sure that members allow some time for processing. We know that that's not the fastest way to make a payment. We do accept it by mail, but please make sure that they understand there has to be some processing time and receipt for that payment. We do accept cash. They can go to any MoneyGram location by going onto the MoneyGram.com website. They can find the location by calling the 1-800 number listed on the screen. Communication process for new members. So once the application is received, once the 834 file is received from the exchange, it triggers a welcome letter and a binder invoice. If they make the payment if they make their binder payment upon the application process, their first invoice will show a zero balance. They will have the opportunity to select their primary care provider if they do make that binder payment. So how do they know who their primary care is? It will be shown on their welcome kit. Once they receive their welcome kit, they will receive their ID card as well. If they do not make that binder payment at the time of application, Molina will select a PCP for them. Other premium notices that they can receive. Binder cancellation notice, very important. If they don't make their binder payment, they will receive a binder cancellation notice. Autopay notices. Few different autopay notices that they can receive. One that I do want to point out is autopay disabled. That's triggered the day before autopay runs, which is the 22nd of the month. It's initiated by us, Molina. It's sent when autopay has been disabled. How is it disabled? If the member completely loses their APTC. So if they do not, if for whatever reason they lose their APTC, they do not get additional information in, whatever the reason may be, they lose that APTC, autopay will automatically be disabled. or if their responsibility is greater than $100 than they were previously paying. Grace period notices, several different grace period notices as far as past due and termination for non-payments, and refund notices if they're due any kind of refund or denied a refund as well. Our Molina Healthcare ID card is changing this year. It will be color-coded for line of business. So a marketplace will be purple. They will not show the PCP name on the ID card. We've had a few complaints from our members stating that there were some primary cares that were not rendering care because their the primary care's name was not listed on the ID card, so we automatically removed that this year. The electronic version will show their PCP, so the version that they can receive on their My Molina or the mobile application that we have will show their PCP name. The Molina Member Services number is the customer support number. There are several different phone numbers which we will be sending out to everyone for the different states. Members do have access to a nurse advice line in English and in Spanish 24 hours a day, Monday through Sunday. This is not to be confused with the teledoc feature. So this is just a nurse giving advice over the phone. The My Molina member portal. The My Molina member portal is a self-service option. So we encourage agents to make sure that members sign up for their My Molina account. They can do several different things on their My Molina. They can make a payment. They can change their primary care doctor. They can update their contact information, request an ID card, get health reminders for services that they may need, and view their service history. If a member does want to change their primary care doctor, they can do so once every 30 days. Please make sure that the members create these accounts by themselves. You cannot create the account for them. You can assist them in creating the account, but please do not create the account for the members. Our Molina Mobile, which is called Molina Health in Hand, they can do several different, same features that they do on their My Molina. They can view their ID card, pay their bill, get their nurse advice line, find a new doctor, change their doctor, view their health records, view their benefits and eligibility, and access teledoc. If a member does choose to make a payment on the mobile application, this is what the screenshot looks like. It's going to show them what their balance due is. It's going to show them their due date. It will also show them their payment history. So if they have any questions as to, hi, I don't remember, I don't really remember if I made my payment or not. Yeah, go into the app, go ahead and go into that payment history, and it's going to show you the date that you made it, how you made that payment, and how much that payment was for. They can also view their service history and their explanation of benefits. So if they do have a date of service that they don't know what the status is, they can click on that date of service and it'll give them the status of that date of service. The Molina Marketplace Broker Resources. As a broker of Molina, you do have access to your broker portal. You can do so by logging on to molinahealthcare.com, clicking on that Brokers tab, and then scrolling down to where it says Marketplace. It'll ask you for your login credentials. Once you're all logged in, you can click on the Book of Business tab in the middle of the screen and click on Book of Business Search. It will promulgate your entire book of business with Molina. What can you see there? You can see the paid through date. You can see the paid on date. You can see if the member's in grace period and see when the grace period started. So very important about grace period. If a member has premium subsidy and they go into grace period 1, they miss that first payment, they go into grace period 2, and they miss that second payment, but they only decide to only make one payment, they're still considered to be in grace period. Why? Because they need to make their complete balance due in order to come out of grace period. So please make sure that if a member is in grace period 1 or 2 or 3, they need to make sure that they make that complete balance due in order to be removed from grace period. And grace period does not restart if they make that first payment. It stays on the same date that they miss that first payment. Very, very important. How does Molina support you? We have an excellent broker support unit in Salt Lake City, Utah. They're separated into 4 different sections. We have our broker services unit, that handles general inquiries, account access issues, member EOC, and SBC questions. We have a broker care team that assists you as a broker to assist members accessing to care issues, billing discrepancies, termination, and errors. We have a commissions team. Our commissions team, very popular in the month of February. I wonder why. So the commissions team has a reconciliation form that you can complete for any unpaid policies or any policies that may be missing from your book of business. Once you provide all the information on that Excel sheet, send it in to the commission inquiry email. They'll research those members to see what's going on with them and give you an explanation as to what happened with them. We also have a contracting department. Our contracting department is in charge of appointment requests, E&O, licensing, and updating your contact information. If you do know that your E&O is coming up for renewal, please make sure that you get it in as soon as possible. That way we can have the most up-to-date information on your profile. They are, as I stated, in Salt Lake City, Utah, so they are on Central Standard Time. So us being in Eastern Standard Time, we have a few more hours of service for them. During open enrollment, they will be open 2 Saturdays. So please make sure to be on the lookout for that email. During open enrollment, they will be open for 2 Saturdays out of open enrollment. So what does our care team handle as far as escalated issues? Escalated issues, they can handle access to care, billing issues, claims, enrollments, member services, and prior authorizations. If you do have an escalated issue, there is a template that you can access from your broker portal, and it looks like this. The more information you have and complete, the faster we can get that escalated issue form, escalated issue completed for you. So please complete all the sections that you have information for and send it in to us at our care team department. The phone number for the care team is 855-885-3179, option 2. This is for the broker partners only. It's not for members to call. So it's for you as a broker. Once you have that escalated issue form completed, you can send it in via email to mpbrokercareteam@molinahealthcare.com. This is a list of all the broker channel managers throughout the United States. So all of Dennis and myself counterparts. We have Ohio, Michigan, and Wisconsin. We have Kasai. California, we have Amy. In Texas, we have Gabriel. As you know, Dennis is on the phone. He is in charge of North Florida and Mississippi, Utah and New Mexico, Adam, and for the state of Washington, it's Casey. So that completes our presentation. I will go ahead and send it over back to Micah to see if we have any questions.
Thanks, Tina. So a lot of really good stuff, guys. They have the network. They have the rates for those of you that haven't gone in yet and check them out. And for those of you that are in South Carolina, you can also do it by going to the SCDOI. They have some listings out there as far as pricing, how they stack up against the competition. And I got to tell you, there's some areas where I've seen that Molina is incredibly lower than the competition. So all very good things. One question here, Tina, was that is there any chance of you guys expanding even next year or as the year continues next year?
At the moment, there hasn't been talk about it. We are expected to go into different areas, but they haven't given us information as far as where to.
Gotcha. And just to make one thing perfectly clear, Molina may be new to most of you out there because they are moving into expansion areas. However, they're not a new company. Molina's been doing this, like they said. We've had a lot of interaction with them, and I got to tell you, they're one of the easiest carriers to use, and they're very transparent when it comes to their commissions, and it's just a really, really good partner for us and for you guys. And to let everyone know
Micah,
oh, I'm sorry, go ahead,
Dennis. Micah, one thing I wanted to bring one thing up that we failed to mention during the presentation. Even though we are listed as an HMO carrier, we really do operate as an EPO, meaning that if you do not need referrals for specialists, for visits to specialists. So if you have basically, if they're on the network, you can go ahead and use them without having to get any referrals. That's one piece I just wanted to mention that we failed to mention during the presentation.
Is this information available for agents as far as network and things? Where should they go to look for that stuff?
Well, Tina did
So
mention
our
earlier.
pod,
Go ahead. You can go.
Go ahead. So our pod will be available on our website on molinahealthcare.com. Just click on the top tab. It's going to show you the state that you're looking for. If you're looking for Mississippi or South Carolina, click on the state at the top, and then click on Find a Doctor or Pharmacy, and then you can go into our pod directory there. It will be up and running on November 1st, Friday.
And just to show how serious Messer Financial is as far as partnering with Molina, like I said, we will be doing we will be covering any kind of appointment fees. We will be doing advance options. Also, if you partner with us in South Carolina or Mississippi for Molina, we will give you an additional $20 per app bonus coming from Messer Financial if you write at least 30 apps with them this year. So again, we want to incentivize you guys to look at them because we understand what kind of carrier they are and how they do business. We really want to partner and push them. I will tell you guys, the one thing that is absolutely crucial for us is competition. As most of you have seen, even in other states where there's only one option, it really limits the opportunities for us as agents to sell. Plus, it gives us job security. And I promise you, when there's more competition, that means higher commissions, larger networks, better benefits. It's just a win-win-win all around for all parties. So we want to do what we can to partner and help them grow and to keep expanding because only good things can come of it. That looks like it's just about it. Tina, Dennis, did you have anything else that you wanted to say in closing?
I just wanted to say thank you very much for your time. We really appreciate it. I know everybody's getting ready for open enrollment and you're extremely busy. Thank you for your time. And for those of you who have been working with us in the past, thank you for your business as well.
Correct. I just exactly. I want to thank everybody for the business and time for joining our presentation today. If you need any assistance at all, please feel free to reach out to us. We're more than happy to help with anything Molina related that we can help you with. So I appreciate your time as well.
And if you do have any questions or you haven't been appointed yet or are interested or want more information, whatever it is, please contact Messer Financial. We are open Monday through Friday from 8 to 5 Eastern Standard Time. So, whatever you guys need, we're here to help you. We have the technology, we have the commissions, anything you need, we'd love to partner with you. So again, I want to thank everyone for taking the time out of their busy schedules to join us this morning, and I hope everyone has a very successful AEP and OEP. Thank you very much. Have a great day. Bye-bye.
Good luck, everyone. Thank you.